Hi friends, going live on Facebook. Just want to say hi to all of you all. And how was your day? Just want to know from all of you all. Just say a comment hi on the Facebook page. Meanwhile, I'll share the Facebook page in my group. I'm just sharing the page here. Once again, just hold on. And we are starting shortly with the live presentation, live session on a very important topic, how to build strong bones. Okay, friends, hi to everyone. I'm back. Let me know a hi from all of you so I know who are there online. And very good evening to all of you all. So today's topic is on bones. As you all know, bones forms an important part of our body. Without bones, we're not able to move, we're not able to protect our body, and it is one of the important functions. It is a storehouse of minerals like calcium, phosphorus. A lot of minerals are being stored in these bones. Also, it is a reservoir of production of red blood cells or blood cells. So it has a marrow which produces all these healthy red blood cells. So let's begin with it. In this session, you will get to know what is osteoporosis, because today we are celebrating our World Osteoporosis Day. What are the risk factors of osteoporosis? What are the strategies to manage your osteoporosis, whether it's a child, whether it's adult, whether it's a old patients? So strategies you will be knowing, which are the investigation you can do, and just stay till the end, because you will know one very important tool where you can assess your fracture risk, a future fracture risk. This I'll be telling you at the end, so don't miss this live session. Very important session of building bones from the childhood to the adulthood. Okay, so today is a World Osteoporosis Day. And what do you mean by osteoporosis? Osteoporosis means that it is bones are fragile and weak, and it is prone for fractures. So once your bones becomes weak and fragile, it is prone for fractures. So that is called osteoporosis. Now, osteoporosis is very significant now. It is alarming situation where the number of cases from 1990 has been increased dramatically. And there's osteoporosis is more common in females compared to males. And if you see males, it is 1 in 5 males which is affected after 50 years. And in females, it is 1 in 3 females which is affected after 50 years. So if you have osteoporosis, the death rate is 25% within the first year. And if you have osteoporotic fractures, you're prone for 50% more prone for fractures in the other bones. Now, fractures occur so frequently that it is 8.9 million fractures occurs every year. Means every 3 seconds there is a fracture. So you must be knowing that how significant it is that we are facing this problem. And as you know, this osteoporosis doesn't have any symptoms. It doesn't have any clinical signs to measure to say that it is a osteoporosis is going to happen. It is just by clinical evaluation and by testing where you can know that you have osteoporosis, where there are risk factors. And it is called a silent disease because a osteoporotic fracture can just occur trivially just by walking, just doing any local work, anything, just jumping like this, and you can just have a fracture, just slipping down in the bathroom, and most commonly, and you can have fractures. Now, fractures most commonly occurs in the pelvic bone, the spine, the wrist bones. Okay, this is the common areas of fracture, and the femoral bone. So most common areas is this, where you get these fractures. Now, why it is more common in postmenopausal women? Because the hormone estrogen has a protective effect in preserving the bone density, and postmenopausal the hormone estrogen is not there, so you're more prone for fractures in the later age group. But how common is this osteoporosis? Now, if you want to build strong bones in the later part, you have to have strong bones in the childhood. So if your kids are there, you need to start them having strong bones at this age only. If it is adulthood, you have to maintain that strong bones. So how you'll do it, I'll be telling you everything in this session. So the foundation of bones starts in the early age. It starts from the childhood age, where you're increasing the bone density. So if you have a good density in the early childhood, and it is said that bone completion occurs by the age of 20 years. So by the age of 20 years, bone density completion occurs, and later on afterwards, it is adulthood where the bone density is maintained. Okay, so in the early part, you have to have a good bone density. If you have a good bone density in the childhood days, you have risk of osteoporosis in the later part. In the old age, it will be reduced by almost 13 years if you just 10% increase in the bone density in the childhood days. Okay, and in the adulthood, in the later phase adulthood, you have to maintain this bone density. If you don't maintain this bone density, because you will be more prone for fracture in your old age group, and you have to be dependent on others. If you want to have a good life in later part of the half, you need to have a good maintenance of the bones during the adulthood stage also. So the primary phase, the building block starts in the childhood, then the adulthood, and later you will have a good life because of you having a strong bones, where you can delay your osteoporosis because of this many factors. Now, the osteoporosis, how often you can say that you are prone for osteoporosis? Osteoporosis means bones which are fragile, which are weak in density. Means if you have a good bone density in the childhood, means a good bones in your bank. Like just imagine if you have good amount of money in your bank in your childhood, and in your adulthood you will have a pension, where you can run a pension later on, where you can work with your own money, where the money will be able to sustain you in the old age group. Same way, if you have a good bone density in your childhood days, if you have a good bone density which is maintained in the adulthood, you will have a good amount of life in the later part of in the old age group. So this is the foundation of having a good strong bones. Now in this video, now I'll be telling you what are the strategies in maintaining a good healthy bones. There are 5 strategies you should know. First is good amount of exercise. Second is having a bone dense nutrient food. Third is lifestyle modification. Fourth is assess your risk factors, and last is talk to your doctor regarding all these risk factors. Now first thing is you have to do a regular exercise. There are 2 types of exercise: weight bearing exercise and muscle strengthening exercise. Now if you do regular exercise, that is 30 minutes per day, 4 to 5 days minimum, then you can maintain your bone density. Even if you're later part of the age, it is the bone density will maintain, which will be maintained 1 to 2%. Also there is chances of increase in bone density if you do good amount of exercise, because exercise will maintain your bone density and also will make your muscles stronger. So muscles become stronger means your alignment posture becomes stronger, and so you will not be prone for injuries and no prone for fractures. So that is important of maintaining exercise. That is called good exercise. That is a weight bearing exercise. And weight bearing exercise could be jumping, running, jogging, climbing the stairs, doing any aerobic works. You can be playing tennis. This is a weight bearing exercise. Okay, and then strengthening exercise means lifting some heavy weights, doing some weights around the exercise bands, using some exercise bands. Now if you want to maintain your posture, alignment and functionality, the yoga could be a best part or combination of all this. So try having a yoga postures where you're doing different posture, where you'll maintain your functionality and alignment also. So having a regular exercise, which is very, very crucial in maintaining a bone health, because if the bone health is not maintained because of the poor muscles, then you're prone for fractures. Second is have a rich food, which is dense food, which is rich in nutrients, which is a bone healthy food. Now, what bones requires only three components. One is calcium, one is vitamin D, and one is proteins. Now, calcium, as you all know, calcium is a rich is in bones. 99% of calcium is in the bones, and it is a huge reservoir. Means the calcium, maintaining of calcium in the rest part of the body, it depends on your bones, and it will help in functioning of your nerves, which will have your functioning of your muscles properly. All requires calcium. So calcium you can have by means of a diet, or it is a supplement, but there is always a debate whether the calcium which can diet can be enough rather than having supplements, because if you have supplements, there is chances that you're more prone for myocardial infarction or something like heart diseases and also renal stone. So try maintaining having a good calcium rich food, which is very optimal, which is required for your bones, rather than going for supplements. Supplements may be required in the later part of the age where you don't have an adequate nutrient food. So basically, so if you have a calcium rich food, that's enough. Now calcium, how much is the calcium requirement? It is required around 1000 to 1200 milligrams per day. In teens, you require around 1300 milligrams per day. In old age also, you require about more calcium, that is around 1300 milligram per day. But on average, 1000 to 1200, it is what is required milligrams of calcium, which is required in this case. So which will be helpful in maintaining a normal bone health. And now, which are the foods which are rich in calcium? The rich in calcium is milk and milk products like cheese, butter, paneer. All these items are very rich source of calcium. If you have one glass of milk 200, you will get 240 milligrams of calcium. And if you have paneer, is a rich source in calcium also. And then cheese, 30 milligram cheese will give you 200 milligrams of calcium. So this is how you maintain your calcium, this milk product. Second is ragi. Ragi is one of the richest source of calcium. You can have ragi dosa, you can have in the ragi enough any form of ragi, which will be very helpful in the childhood days and also helpful in the adulthood days. If you can, child also requires same calcium rich food, so you need to supplement them with always with the dairy products, always with cheese, butter, paneer. All these items, paneer can be, you can have a different delicious dishes made of paneer. So all this you can supplement, all this you can give to your child for building your bones. And it has been said that 80% of the nutrients milk and dairy products are enough for the maintaining of calcium, proteins, and vitamin D. So 80% of the requirement comes from this only. So other sources of calcium includes, like, you have nuts, almond, pistachio, all these nuts. You have vegetables like broccoli, spinach. You have figs. You can, if you have 4 to 5 figs on a per day, you can get 100 milligrams of calcium. So this is overall, which is a rich source of, and all these legumes, lentils, chana dal, all these dals, which are different dals which are there, a rich source of calcium. So try to having all these nutrients, you'll get the calcium in that. See, calcium, you have to use it you have to take it by means of a diet only. That's the best thing, rather than taking supplements that is required in old age group. So but in our age group, in the young, in the teens, and also in adulthood, you require calcium basically from your diet. Second is vitamin D. Vitamin D is very crucial because it helps in absorption of calcium and it helps in bone mineralization. So bone density is maintained because of vitamin D. Now, you should remember the richest source of vitamin D is sunlight. I hope you know that. But how much we get exposed to sunlight? It is impossible because of our lifestyle. We are mostly indoors. So we don't have a proper exposure to sunlight. So what we require is sunlight of 10 to 20 minutes on a daily basis. If you can do it, it will be a great source of vitamin D for your body. And most of the vitamin D is formed in the skin. So just exposure to a sunlight for 10 to 20 minutes, and the sun, and the which time you need to expose is before 9 a.m. and after 3 or 4 p.m. That is the best part, because the mid sun is very it is very harsh to, it can be very harsh to your skin. So exposure, the exposed part of your body on your face, you need to get exposed to a direct sun, and that will help you in building your vitamin D. You need not apply sunscreen, because sunscreen will decrease the absorption of vitamin D. So direct exposure to the skin is what we require for the vitamin D. Okay, these are the two things in case of mineral. Third is proteins. Proteins are the rich source of building blocks of amino acids, and if you have rich source of proteins, it will help in building your bones. And if there is undernutrition of proteins in your diet, means 40% bone loss will occur because of this. So have a proteins. Proteins will also help you in building your muscles. It will help in muscle strengthening. That is also required. So protein sources, how much proteins is required is 46 to 56 grams of protein on a daily basis. Now sources are same: dairy products, milk, legume, lentils, all whole grains, quinoa. Non-veg, you have fish source, you have all this fish, meat, poultry. All these sources contains rich source of plant-based also foods has a rich source of proteins. If you are vegetarian, plant-based source also gives rich source of proteins. You need not worry about that, because plants also contains proteins like spinach. All these vegetables, green vegetables, vegetables which are rich in vitamin C also helps in calcium absorption. So this is a requirement. I just forgot to mention how much vitamin D is required. Vitamin D in the childhood days, you require around 600 international units. For adulthood, you require around 600 to 800, and in old age, you require around 800 to 1000 international units per day. So this much vitamin D is required. Vitamin D from the diet is very less, because there are very less sources of vitamin D from the diet. Main source is sunlight, and vitamin D from the, basically it comes from fishes, salmon, sardine, mushroom, eggs, but not so great source of vitamin D. Therefore, you have to supplement with vitamin D. Vitamin D supplementation is required. Even if your childhood days, you need to check your kids vitamin D, whether it's an optimal level, whether it's low level. You have to supplement for 3 months and then take a break, and then you can, if the vitamin D is low, still you can take one other course of vitamin D of 3 months. So like this, you have to maintain your vitamin D. Because of your lifestyle, which has significantly changed now, because we are not getting exposed to sunlight, we require vitamin D. That is very essential for bone formation. Third, I have told you protein. So these are the 3 nutrients which the bone requires and bone likes: vitamin D, calcium, and the proteins which are required. Are you there with me? Okay. So what are the things, how much, I want to know from all of you, how much sunlight you get on a daily basis? How much you get exposed to sunlight? Can you write in the comment box how much you get exposed to sunlight? Hi Rati, hi Shweta, hi Shushan. Okay, so exposure to sunlight is the must for vitamin D. Now I'll come to tell you that there are 2 things which I've told you: exercise. Secondly, I have told you bone nutrients which are required for building strong bones. Third is your lifestyle. What are the factors which affects your bone? First thing, if you are a smoker, then you will be significant amount of bone loss will occur in you. Whether you're a prior smoker or you're smoking on a regular basis, it is have a bad effect on your bones. So if you are smoking, just stop it, because you're prone for fractures in the later age group. Second is alcohol. If you're having a regular alcohol increases your fracture risk by 2 or 3 times. And why it occurs? Because alcohol inhibits the calcium absorption from the intestine, so you're more prone for fractures. Also increases the hormone, stress level hormone called cortisol, so that also causes bone loss. So if you're having regular basis of alcohol, definitely low down, maybe later on, you'll prone for fractures. Third is maintaining an optimal body weight. If you're under your weight is less, underweight, then also you're prone for fractures, because if your BMI is less than 20, it is 2 times more risk than BMI of 25. So you need to maintain an ideal weight. Also, if you're obese, you're also more prone for fracture, because it puts some additional burden on your joints and your bones also. So try maintaining a healthy weight, and that is optimal BMI. That is very, very important for maintaining your ideal weight. So because that forms your foundation of forming a strong bones. Secondly is the other point is required is excessive caffeine intake. If you're having coffee on a regular basis, 7, 8, 10 cups of coffee on a regular basis, and definitely it will have a bad effect on your 2 or 3 cups per day of coffee is fine, no issues. But if your excessive amount of coffee and caffeine contain tea in form of tea or coffee, will have a bad effect on your bones. Other things is what your effect is you'll have is if you have excessive amount of thyroid hormones. If your thyroid levels are very, very high, your bone levels will be getting affected because of this. So check your thyroid hormones. If your thyroid hormones are very, very high, then also your risk of fractures are more. Anyway, age, I've told you, anything above age 50 and above are always a risk of fractures, and therefore you have to maintain a healthy weight. Then if you have a prior fractures, that is also you need to take care of. Okay, that is also important. So these are the things. Then you have to know like which are the drugs, medications which make you prone for fractures. The most common drug which most of it take is steroids. For it could be medications or steroid to build your muscles. It will cause you significant bone loss. Any other treatment like antipsychotic treatment, anti-depressant treatment, excessive amount of thyroid hormones can all cause bone loss. So know your risk factors of bone loss. If you have a family history of osteoporosis, then also you're prone for in you there will be risk of fractures. Other conditions like bowel diseases, like inflammatory bowel diseases, will inhibit the absorption of calcium. Rheumatoid arthritis can cause osteoporosis. So these are the factors you need to know which causes you fractures, can cause you fracture. These are the conditions. So you need to know all this, because this is risk factor will help you in noting down whether you are risk of fracture. If you have anyone in your house who is above 50 or 60, you need to assess them in case of a fracture, whether they are prone for fracture in the later age, whether they are prone. So you can find out now only, because by means of a simple testing, which I'll be telling you later. So risk assessment is very important. What are the risk factors are there in your, that is also important, whether you're taking medication, rheumatoid arthritis, we have bowel diseases, whether you have early menopause. Early menopause means having menopause at the age of 40, then your risk of osteoporosis and fractures later on also increases. If your ovaries are removed in the early age, definitely your risk of fractures also increases. So a lot of this condition is more common in females. That's why females have to be taken more precaution in this, because their risk of fractures is more in this case. So assess your risk factors. Once you assess your risk factors, lifestyle of change is there. Now you need to speak to your doctor. If you find any of these risk factors you have, you need to speak to your doctor. Now a doctor will assess you clinically whether you come in high risk category, whether you are taking any medications like medications which will cause you bone loss, whether you're having cancer, whether you're having diabetes, whether you have low testosterone, whether you're not getting exposed to sunlight, whether your age is more than 50. All these risk factors will add your risk factors to your bone fractures. So you need to know your risk factors. It need not be you. It can be anyone who is in the house. Your parents it could be your grandparents. So you need to assess them by means of fracture. But you can, by assessing them, what you can do, you can prevent them from they getting fractures. Because if you supplement them with, if required, a vitamin, exposing them to vitamin D, taking supplements of vitamin D or calcium or good diet, you can prolong this osteoporosis and the risk of fracture in this patient. So now regular x-rays Now, which is the investigation which is important, which will help you in detect this osteoporosis? That is called DEXA machine. It is a machine available where you can detect the osteoporosis, and it can detect the osteoporosis when the bone loss is just 1 or 2%. If you take regular X-rays, it takes 40% reduction to know whether you'll prone for fractures. 40% reduction in the bone will be shown in X-ray. By this BMD, it's called the DEXA machine, will help you in detecting osteoporosis at a very early time. So you can, if you have anybody in the old age group, you are in the high risk category, you can speak to your doctor and get your DEXA scan done, and it will help you in assessing whether you have osteoporosis, whether you have osteopenia, or you have no normal thing. So that scan is important. And one important tool I want to mention you is where you can assess your fracture. You can Google it, and it is very easy to mention. So you can let me know later how you find this tool. That is a fracture risk assessment tool. That is called a FRAX. It is called a FRAX, the fracture risk assessment tool. It is usually starts from the 40 years. It helps you in detecting a fracture. It is a simple parameters where you can just tick mark in that, whether what is the age group, what is the height, what is the weight, then what is, whether you're taking medication, whether you have this medical condition, all this you have to tick mark, and they will give you a criteria score where they will tell you whether your risk of fractures in future, whether your risk of osteoporosis. And it is very simple tool which you can just Google it. It is called a fracture risk assessment tool. You can get it done just online for your parents, for yourself if you're in the higher age category. So this is the very important tool I wanted to tell you. So try Googling this tool and let me know later on how you find this tool very useful. Let me know in the comment box. Okay. So this is useful strategies which are there to building your bones. Whether as childhood you require vitamin D, you require exposure to sunlight, you require good amount of exercise and good diet. That is what is required, and the lifestyle modification which will help you in building a very strong bones. So first thing is exercise, second thing is a good nutritious diet, third is a lifestyle changes, assess your risk factors and talk to your doctor. Very important. If you can detect this condition at a very early age, definitely you can reduce the risk of fractures and reduce the risk of osteoporosis in the later part. For all people, all if you're in the high risk category, just do it, and it's very simple. So because it is one of the preventive aspect. See, once you get fracture and then treating, it is very difficult later on. So try getting assessed now only, that so as a result you will know your risk category, what risk category you falls in, and then you can take preventive measures, whether it's yourself or your family members also. So these are the few of my tips which will help you in building a strong bones. And I hope you like this session. Let me know in the comments whether you like this session. Let me know about the tool also which I mentioned you, which is very important, because this tool will help you in assessing your risk. That is called fracture assessment tool. Get it, just check it, Google on online, and let me know in your comment box. Okay, if you like this video, just share it with your friends so that they also know about this fracture, how to build a strong bones, which is required by means of a good diet and exercise. Also, I'm doing regular Facebook lives also, so you can subscribe to my page and also YouTube channels to get regular updates. So thanks for being online, and thanks for watching this video, and good night and God bless.